Hey, to those of you on the phone, we'll begin in just a second. Just remember, you're all muted. It's *6 to unmute and ask a question, and then *6 to mute yourself again afterwards. Thank you. Ready? Hey, good morning, everybody. Thanks very much for joining us today. It's been a couple of months at least since we've had to have one of these briefings. We like to do this particularly for our partners in the media. You guys do a great job getting good information out to the public, and so this is really designed for you all to answer your questions and try to give you as much information as we can. I just want to start here in the new year just remembering two groups. Remember our healthcare workers. Remember the people who are frontline workers in hospitals and clinics and doctors' offices, our EMS people who are working every day trying to control this epidemic, the people who work in public health, the people in this building, the people who are working our county health departments, people all over the state who are now about to begin their third year of doing this work. We're just really grateful for them and appreciate them. The second group I'd like you to remember are the 9,310 Alabamians we lost this past year as we begin the new year. We now have lost 16,496 Alabamians to this disease since the beginning, including 41 deaths that were reported to us yesterday. So we unfortunately are not in a real good place right now. We are seeing the highest daily case numbers that we have seen since the pandemic began. Over the past 7 days, we've had numbers in the range of 8,000, 8,000, 7,000, 5,000, 4,000, 7,000 more yesterday. Several of those are actually records compared to what we have seen before last week. So these numbers are higher than we have ever seen before. All counties in the state of Alabama are in the red zone, in the highest level of transmission category. Our percent positivity rates is almost 39%. Almost 4 out of every 10 tests that are being done are returning to us as positive. Remember that we actually have no visibility on home antigen tests that people are doing. Those don't get reported to us, so undoubtedly there are a lot of tests out there being done, many of them probably positive, that we actually don't even know about. So we tend to think we're undercounting the number of cases that we've seen. Really the take-home point from what's going on right now is that the Omicron variant that is becoming the predominant variant in this country is incredibly contagious. It is much more contagious than the Delta variant. It is many times more contagious than anything we have seen before. Many orders of magnitude more contagious than the original strain that we had 2 years ago, almost 2 years ago. And it is just spreading like wildfire. It will infect everyone in this state at some point, probably, or most of them. So we really need people to do the single most important thing they can do to protect themselves, which is to be fully vaccinated and boosted when it's appropriate to do that. Being fully vaccinated and boosted seems to protect most people against serious illness or hospitalization or death. We don't have a lot of good numbers on that point yet because this is such a new variant. We just learned about it the last week of November. But to the best of our knowledge, from what we've seen in other countries and what we're seeing right now, vaccination remains the single most important tool we have to prevent serious illness or death. We are seeing spikes in our hospitalizations right now. We yesterday had over 1,100 hospitalizations. We were down around 300 just about 2 weeks ago, a little over 2 weeks ago. So we've increased threefold, almost fourfold in the past 2 weeks in terms of the number of people who are hospitalized. That's normally a very manageable number. 1,100 inpatients is a lot of people, but you know it's a third of where we've been at some points during the pandemic. Although I will say flu season is also going on, hospitals are dealing with that, and hospitals are dealing with unprecedented numbers of infected healthcare workers right now, either infected or in some cases just exposed. So it is creating some difficulty for our hospitals simply because they have many of their healthcare workers who are just not able to work right now because of the infectiousness of Omicron. It's a very challenging situation. We have seen some data from the UK and other places that you've probably read about that suggests that Omicron causes somewhat less serious illness overall than the Delta variant. That we think that's probably true. That certainly would be good news if that turns out to be the case. The UK study that I just mentioned showed that it caused death about half as often as the Delta variant, so that would be terrific. Here in Alabama, our experience with Delta was that about 2% of all people died who were infected with that. If Omicron, if it is shown to be that, for example, maybe only 1% of people die with Omicron, that's still 10 times the rate of what we see people with influenza dying from. It's still, tenfold more dangerous than influenza. And even if it's half as deadly, if you have a variant that infects twice as many people, you can see your numbers turn out to be the same. You still have the same issues with a surge affecting your hospitals and numbers of people getting sick or dying. We certainly hope that it is less serious overall, and maybe that'll prove to be true at some point. I want to mention finally, I'll just say we think probably most of the variants that are circulating now are Omicron. It's really difficult to prove that at the moment, just given the relatively low amount of genomic sequencing that's going on. We do have several places doing sequencing. Our state lab is doing it. Several other labs in the state are doing it. Several national labs accept samples and do that in Alabama, as well as CDC continuing to do their sequencing. So we do have a lot of data points, but overall the numbers are still kind of small, given that Omicron's only been identified just about 5 weeks ago. But internationally, we've seen Omicron tends to replace Delta pretty quickly. That certainly happened in South Africa. It's almost happened in the UK. We are seeing in the northeastern U.S. and Omicron has become the predominant variant pretty quickly. So we believe, just given this sudden surge, including breakthrough cases that are happening, that we probably have a different variant out there. So certainly Omicron is the likely candidate, and we think most of the cases we're seeing now are Omicron. We'll have enough data to say that in the next 2 or 3 weeks, I think. Let me mention vaccinations again. That continues to be our primary tool. We've had about 2.7 million people who received 1 or more doses. That puts us about 45th in the country. That's not nearly good enough. Over 2.2 million people are completely vaccinated. That puts us ahead only of about 2 or 3 other states. And again, that's not nearly as good as we would like. We are seeing a lot of people who are getting booster doses. Almost 600,000 additional doses have been given. Third doses have been given. Some of those may be primary course third doses for immune-compromised people, but I think almost all those are booster doses. So we are seeing a good uptake among booster doses. But again, we still have a long way to go to be where we want to be. The best states in America, have vaccinated over 85% of the people with at least 1 shot, some approaching 90%, and we're just over half of people have had at least 1 shot in our state, so we have a long way to go. I wanted to take a minute just to talk to you about the change in CDC quarantine and isolation guidance that's come out sort of in dribs and drabs over the past 2 or 3 weeks. It's actually been really confusing to a lot of people. We've had a lot of questions asked about it, and we've had questions, in fact, that we haven't been able to answer because we're still awaiting guidance in some cases. But generally speaking, what CDC has said is that people who have tested positive for COVID, who are getting better and don't have fever or who don't have any symptoms at all, by day 5 can consider going back into public as long as they can wear a mask for an additional 5 days. There are a number of caveats around that. It certainly is a good idea for those people to get tested, although CDC so far has stopped short of saying they have to have a test to come out of isolation at 5 days. They've said specifically that this applies to the general population, but does not apply to schools. It does not apply to healthcare facilities. It does not apply to other congregate settings. They are working on additional specific guidance for those groups. The number one priority they have told us, is getting out new school guidance. I know many schools have called us about the fact that they've seen this 5-day quarantine rule and think that that should apply to schools, and it does not. We have tried to put out statements on our website referring people to our toolkit, our school toolkit. Our guidance for schools has not changed. We continue to recommend universal masking in K through 12 schools. We are still encouraging everyone to follow exactly the same guidance that we have been doing all along. Nothing has changed with regard to what we're saying to schools. As soon as we get additional guidance from CDC, we'll certainly review that and presumably adopt that as soon as we have the ability to do that. Let me just take a minute and recognize Dr. Karen Landers on the phone. I think, Karen, you're on the phone. Did you have anything you wanted to add about the schools?
Dr. Harris, thank you. I had a moment to unmute the line. I would just really like to reaffirm what you have said, and that is that after the initial CDC media release about shortened isolation for the general public, ADPH specifically sat in on phone calls with multiple expert groups discussing this and clarifying that this guidance did not apply to the school setting. And the reason for that being is that obviously while all of us are exhausted from COVID and all of us want to make everything simpler, we must continue to take the strongest measures possible to protect our children and also protect those people who have dedicated their careers to taking care of children. Again, our educators, our educational staff. So just to remind that, we're not certainly trying to lag behind on this, but we want more clarification, and we want to do all we can to, again, protect our children, protect our educational system, and keep our children in school. So we're going to be watching very, very closely for additional guidance, combing the literature, and awaiting further information regarding the questions we posed. Thank you.
Thank you very much, Karen. I appreciate that. I'm sure there'll be questions about that. We'll be glad to take those as well. Just a couple of other issues that I wanted to bring up. Since we've had our last press briefing a couple of months ago, there have been a lot of changes with regard to monoclonal antibodies that are available for outpatient treatment, and now we actually have 2 new oral drugs that have emergency use authorization as well. And I'll just really briefly mention those, but I'm very happy to go into more details about that if you like. I think the point that we are most interested in trying to communicate to the public, but also to providers, is that given the fact that Omicron is becoming the most dominant variant, may already be by far the most dominant variant, we do have different changes in the monoclonal antibody regimens that we recommend. There is a GSK monoclonal antibody called sotrovimab, and it is the one that retains activity against Omicron. The others that are on the market, the Regeneron product and the Eli Lilly product, don't seem to be active against the Omicron variant. And so there was a brief pause a couple of weeks ago. HHS said that we're not even going to ship the Lilly and Regeneron products anymore because we don't think they're going to be effective. There's, for whatever reason, a lot of discussion in Washington about that. And so just last week, HHS has said, well, the pause is over. We'll be glad to ship them if anybody wants them. Our recommendation is that unless you know what variant you're treating, in most cases, it really ought to be the Glaxo product that's being used because Omicron is the most dominant variant. That's a real challenge for our providers because you really can't usually get that variant information back in a timely way. If you have to send that specimen off to get it sequenced somewhere, it's just going to take several days, and by then you're kind of out of the window for treatment. So it's really challenging for providers to know what to do. Our recommendation is that you ought to use sotrovimab if you can get it, but like we've said many times with many different aspects of this response, it's in very short supply. We don't have a lot of it. We're on an allocation just like every other state. I think this coming week we're going to get a total of 420 doses of sotrovimab. Remember, we're having 5,000 or 6,000 or 7,000 new cases per day and once a week we're getting 400 doses of this product. So there's not nearly enough to go around. Based on the amount that's actually been requested by providers, I think we've got about 3% of what people are requesting. Our pharmacy team has done a terrific job of trying to fairly allocate that. We have that spread around the state geographically. We have it in a lot of different communities, and we follow how that's being utilized so that we know from week to week where we need to send that. But there's just not enough to go around, which is a real difficult problem. We also have, as you know, 2 new oral medications. I'll, again, be glad to go into detail if you'd like us to discuss those, but I'll just say briefly, there's also not nearly enough to go around. We're getting a state allocation every couple of weeks of just a few hundred doses, I think 500 or 600 doses of the most effective product, which is the one made by Pfizer called Paxlovid. And again, we're having thousands of cases a day and just getting a few hundred doses every couple of weeks. So that's a real challenging situation for us right now. Paxlovid and the other Merck oral medication are going to be dispensed through Walmart at the moment, one of our federal pharmacy partners. We have worked with Walmart to make sure that they have it spread evenly all over the state. They have the ability to move it around if it's not being utilized. Obviously, ultimately, this will be a normal prescription drug that's available in every pharmacy everywhere once it's FDA approved. But at this point, given the small numbers of drug available, that's the location that it can be dispensed from, just with a prescription by a provider. I finally wanted to just mention testing. Testing, has become a huge problem for us. You can see the sheer numbers of people who are out there seeking tests, and these are people who are getting tested because they feel sick and they want to have a test done in a lot of cases. We do not have enough testing to go around. I don't think any state has enough testing to go around, but we're working very hard to address this. It is possible still right now to get tested every day in every county health department in Alabama, maybe not all day long every day, but there is some testing available every day, just like there's vaccinations available every day in every county health department around the state. We are working with some of the private vendors that we had worked with previously to see if we can get additional testing sites set up again. You may remember we did that in several cases back during the surge last summer, and we're trying to get those to be standing up again as soon as we're able to do that. I will tell you, our hospitals have reported that they're seeing a demand of people who are just showing up to get tested, and that is not the right place to go. Please do not go to your hospital just to get a COVID test. Go to your hospital if you are sick and you think you need hospital care. Obviously, that's where you want to go. But for a routine test, that is not the place to go. That is not the best way to do that, and it unfortunately consumes a lot of resources that hospitals need to put elsewhere. So if you have other options, please go elsewhere. Please don't go to your emergency department to get that tested. So I know I kind of flew through a lot of that. I've got a lot of other data we can go over, but I think I'll just pause right here, and I'd certainly be glad to start answering questions.
When do you think the coronavirus will become an endemic, like things like the cold and the flu, and what's the timeline for when we'll cross that bridge into going back to normal, and do you think the Omicron variant will help us do that?
Yeah, so I think it is endemic, and I mean, it's here. It seems like it's here to stay. It's going to be very difficult to imagine it ever completely disappearing. I would caution people about linking it too closely with our experience with flu. Remember, I mean, this is, even now, this is a disease that's probably at least 10 times as deadly as the flu, and until recently we said 20 times as deadly as the flu. It was only, a few months ago in our last surge that we had so many people in Alabama hospitals that from COVID that people with routine everyday broken legs and heart attacks had to go to other states to get care. So this is absolutely not the same as the flu. At the same time, we may just have to accept that we're going to be dealing with it, and that's exactly what we're trying to do. The way we deal with it is we protect our most vulnerable people, our seniors and our people with chronic health problems. We do what we can to limit the spread in the community by vaccinating everybody possible, and then we try to make sure our healthcare facilities are able to handle those surges when they come. So we're all ready to move on. We're all tired of this. Nobody wants to keep talking about COVID. Certainly nobody in this building wants to hear that word ever again. But we're not out of the woods. And, I just mentioned to you, we had 41 people die yesterday. We don't have that with the flu. We don't have that with common colds. It's just not the same thing.
Dr. Harris, this is David Preston with Family News Now, and I have a question that's along those lines. Seeing that the COVID is probably here to stay, and it can go anywhere and everywhere it wants to go, including Antarctica, and news out of France seems to indicate there's a new variant that has been discovered there. Do you think, as the state's top health officer, that it's time to move from a public health policy of hide from and eliminate the virus to mitigate and manage the virus, kind of like we do the flu, like you just mentioned? And if so, what policy changes from the state level do you think that we would see that were different from what we're doing right now?
Thanks for that question. I think I would say a lot of the things that I just said. This is not the flu, and it's a mistake to treat it that way or to think of it that way. In terms of having a disease that we always have to deal with, I guess that's the sense in maybe what you're saying. We should think of it like the flu. But we have a completely wide open society at this point. We don't have health orders in place that are compelling people to do anything. Alabamians are making their choices to live any way they want, and I'm not sure what other policy changes could make things more normal for people. The reason things aren't normal is that we have thousands of people getting sick every day, and we have dozens of people dying. And I don't know what policy change is going to improve that situation. What less restrictive policy change is going to improve that situation? Yeah, Kim.
Nationally, we're seeing record numbers of children hospitalized, although that's still a very small percentage of infected children that end up in the hospital. Is there any indication that children are more susceptible to Omicron, or is that a factor of the contagiousness?
So we've got about 34, I think was a number today, pediatric hospitalizations around the state out of 1,100. That's a little bit higher percentage than we were seeing before. We had numbers in the 30s and 40s of kids back when we had 3,000 people in the hospital. So I would just say that's one data point. I'm not sure you can jump to any conclusions from that. I've seen, honestly, not scientific reports, but national media reports saying, some people think it tends to affect kids more often. And maybe it does. Clearly, the question is, does it affect kids more than adults? And I don't know if that's true. Clearly, this infects everybody more than the previous things infected anybody, right? And so more kids are going to get infected than previously. Also, kids are still by and large our largest unvaccinated group, and vaccination is the thing that seems to be most helpful in preventing infection. So I don't know, but it certainly could be the case. Yeah.
What's your recommendation for state lawmakers and the general public about, because we have an upcoming session coming up, what's your recommendation as far as accessing the state house?
Yeah, we actually have some calls with the leadership later this week to talk about that. It's a difficult situation. Our legislators are, compelled by law to assemble, and they have to keep the business of the state running, and there's no question that their duties, can't just be stopped or put off. In terms of having people there, our guidance is going to be the same as it was for the previous session. We need people to do everything possible to keep people as safe as possible. Whether visitors can come into the building or not, honestly, is a legal decision. It's not a public health decision. Can you legally keep people out of the public space when the legislature is in session? I don't know the answer to that. But our guidance is the same. We know that this disease spreads when you have lots of people packed close together, unmasked, indoors, particularly if they're unvaccinated. So anything you can do to mitigate any of those factors is the way that you keep people safe. Yeah, Mike.
You mentioned the severe shortage of the monoclonal antibodies that are effective with Omicron and the 2 oral medications, both not nearly enough as we need. What's the long-term outlook for that? And in the meantime, are there any other treatments that are helpful for people after they are diagnosed?
Those are the ones that we have the best evidence for, and the production of all of those is ramping up, and is only going to increase. We expect in a few weeks we'll have a lot more of it, just like we saw with the supply of vaccine, or like we saw with the supply of test kits or whatever. It just takes a while to ramp up to full full production. What we hope is that by the time we get lots of supply out there, that we don't have a different variant that those are now rendered ineffective for, and you just don't know how to predict that. But hopefully that'll be the case. Those are definitely the most effective things that we have.
Kind of following up on that, people are having trouble finding tests. I know this isn't unique to Alabama. This is something that's going on all across the nation. But what's the timeline for getting those testing sites up that you mentioned, and how can we prevent this, and ensure that testing is readily available when people need it, and not when it's too late?
No question that we don't have enough tests. One thing that we're, I'll say this first, one thing that we're, sort of looking towards is what the federal government, recently announced. They expect to have, I think the number was several hundred million, see I wrote it down, 500 million over-the-counter tests within the next month or so, they've said, that'll be available to people free of charge, and it's not clear if we're going to be in charge of shipping those out or if others are going to be shipping those out. But certainly there'll be a greatly increased number of tests that are available to people through that aspect. In terms of what we're doing, we're working on it as fast as possible. I don't know what the timeline is, but we are already having meetings and phone calls with these vendors who do this, and they're people that we've worked with before, and so we hope that we can get things up and going very quickly. We do have federal money that'll help to defray the cost of that, so money's not a limiting step right now, but hopefully as soon as possible. Yeah, let me go to the phone there. Yeah, go ahead.
Okay, hey, thank you. This is Morgan with Fox 6 in Birmingham. Along the lines of the federal announcement, the president said, I guess a couple weeks ago now, that states would be getting more in terms of additional staffing, and then also FEMA might be setting up more testing sites. Has Alabama heard specifically anything from that extra relief for hospital workers right now?
I would say, not to my knowledge, I have not heard that. I've heard what you are referring to, but I have not heard any specifics on that. There is, the ability, again, to access some FEMA dollars for testing, and we have talked to them about doing that as well. Those are not, when you go that route, those are not quick processes. Those are actually really slow processes, and it takes a long time to go through the steps of doing that. So we certainly have that as an option if we need to do that.
One more question for you. Just going back to the CDC guidance with the 5 days for everyone else, but then I think the CDC is recommending 7 days if a healthcare worker is asymptomatic after getting tested. Can you explain the difference between why a healthcare worker should stay for 7 days, but everyone else in the community besides schools, it's 5 days?
Yeah, I'll do my best. See, I have that here somewhere. I was going to try to refer to it. Yeah, so what CDC's guidance about healthcare facilities said, it actually, makes a difference whether people are vaccinated and boosted or, not, either, incompletely vaccinated or unvaccinated. And it has to do also with whether the hospital is in a particular crisis situation. Are they just under conventional conditions where, staffing is okay and numbers are manageable, or is it, this intermediate category they call contingency staffing issues, or is it a true crisis situation? So there's a lot of variables there. Because hospitals contain our most vulnerable people, I think the CDC was unwilling to go to 5 days on healthcare workers who are going to be working in these facilities where people are already ill to begin with. Obviously, as a hospitalized patient, they, are going to be more vulnerable than people on average. I will tell you that CDC's guidance, it does allow for 7 days with a test, or it does allow for other things, but it doesn't prefer that. It actually still prefers 10 days. That's the, for people who are vaccinated and boosted, it still prefers people go home for 10 days, just like we have always said. But it just understands the reality of the situation we're in. Under crisis situations, which I don't think we've ever experienced this definition of crisis. It just says that even if people are infected, they can come to work as normal. Well, we've not been to that point in America yet so far, thank goodness. But that was one of the things that they actually put into print, just in case that situation should arise. So, again, they prefer to keep healthcare workers out longer simply because of the population they're taking care of, but they just understand in some cases that might not be possible.
Dr. Harris, on school quarantine numbers, is the time outlined by ADPH's school toolkit, is that merely guidance or is that a requirement? And if it is a requirement, how will that be enforced?
In the toolkit on which part? On quarantine and isolation guidelines, or?
Yes, on the 10-day quarantine time.
Yeah, it's our guidance based on the best public health guidance that we have from CDC. We don't have the ability to enforce it, but we work, very closely with schools and try to make them understand, what the guidance is and why we're doing that. Ultimately, a lot of these decisions are made by local school boards. That seems to be what Alabama communities think they want to do, and we can't always, ensure that they're following everything that we would recommend. I think that's unfortunate, and we certainly hope they will and try to educate them better to understand the medical reasons that we're making the recommendations that we have. But ultimately, they're going to make those decisions locally.
Hi, this is Jared Hopkins from the Wall Street Journal. I was just wondering how many courses of treatment of each antiviral Alabama has received so far, and then to just follow up on what you said earlier, is Walmart the only location to receive any of the COVID antivirals so far?
Yes, to answer your second question, yes, at the moment, Walmart's the only one who has received them so far. In our state, if you're not familiar, that's actually the one facility that's kind of omnipresent in Alabama, and we have them in a lot of rural communities, and we have them, spaced everywhere. And so we identified them as one of our federal pharmacy partners who agreed that they would work with us to make sure we were targeting our highest SVI counties, getting them to our most vulnerable populations, but also had the infrastructure that would let them move them around at our request if we were seeing low utilization in one place or another place. In terms of the total numbers, let me see if I think I have that information in the room here. Just one second.
So, Dr. Harris, and Nancy can correct me, you have 780 courses of the Pfizer. Merck's still not in here yet.
Okay. So far we have 780 courses of Paxlovid, the Pfizer product. The Molnupiravir, the Merck product, has not arrived yet in Alabama. Do we know what we're going to get, what our allocation is going to be?
Just over 3,000. Just over 3,000 courses.
We're told that we're going to be allocated just over 3,000 courses, but we have yet to receive any of them.
Thank you.
Dr. Garrett, do you know how many of the 780 doses have been prescribed to people?
No, I don't have that information. They are required to report their usage to HHS, so we'll eventually have access to that, but I don't know that to this point. I can just tell you anecdotally, I've had a number of calls from Alabama providers who, said they used the, 20 doses in their local store in one day and are completely out. So I'd say most of them, but I don't know the exact number. Yeah. Okay.
Given the high rate of infections and the limited supply of treatment, are there triage guidelines in place of who should go to the first of the line?
Yeah, so we spent a lot of time trying to determine how we would issue that guidance, and ultimately we have just used the language in the EUA to guide providers, which is that it needs to go to people who are vulnerable to serious illness or have comorbidities or older age. We have tried not to be too prescriptive otherwise, and that leaves a lot of flexibility for the provider to do that. So these are not for every person. They're not for people who are young and healthy and otherwise likely to do well, but they're for people who are seniors who have chronic health problems. Frankly, in Alabama, that's a lot of people, as you know. But beyond the language in the EUA, we've not been prescriptive about that.
Dr. Harris, Starlin Singleton with NBC 15 in Mobile. We're seeing right now a 44.7% positivity rate in Mobile County, which is on the higher end of the state. Do you have any guess as to why it's so much more high down here than maybe in some other parts of the state?
No, I don't know in particular. I would say that every single county in the state is beyond the threshold for being a high transmission county, and I don't know that there's practically speaking much difference between 37% statewide and 44% in your county. Those are all bad. No matter what degrees of difference there may be there. So I don't know. Clearly we are counting only people that have these PCR tests, which are done by laboratories and reported to public health. And so it may be that you just have differences in access to that kind of testing, that maybe another county, people are relying on home antigen tests or something. I don't know for sure, but I would say none of those numbers are very good. And so, yeah.
Forgive me if I missed this. The last I heard from the hospital association was about 32% of patients they have data on were vaccinated. Are we getting booster data on hospitalized patients? And do you know what that is?
We don't have it yet. We've asked them to try to start collecting that, so we're working on that. But about 2/3 of the hospitalized patients, as you said, are unvaccinated. About 1/3 are vaccinated. That's kind of consistent with what other people are reporting with regards to Omicron. It does cause breakthrough infections. I guess one way to think of that in sort of really rough terms is about half the state's vaccinated, about half the state's not vaccinated, and yet the unvaccinated people are 2/3 of our hospitalized patients. I mean, it clearly, being vaccinated protects you against hospitalization. Hopefully we'll have the booster information soon, but we just don't have it yet. Okay. Any other questions? Okay. Listen, thank you guys for your time today. We appreciate it. We'll continue to do these as long as you find them helpful. And just want to encourage everyone to please be safe, get vaccinated as soon as you can. Thank you.